Video essay questions 2, bones. First question. Your x-ray exam reveals that you have fractured your fibula. Your physician remarks, well, it's better than breaking your tibia. Explain why a fracture of the tibia will be worse than a fracture of the fibula. Well, a tibial fracture is worse because the tibia is actually the thicker bone, and it also is the weight bearing bone. Um, if you fracture your tibia, in most cases, you would not even be able to walk on it. And if you did attempt to walk on it while it was injured, you would risk the chance of causing more damage to surrounding tissues and ligaments. In fact, the recovery time for a tibia is 4 to 6 months. The recovery time for a fibula fracture is about 12 to 16 weeks. So that's why the physician made the remark that it was better that you had, or the individual had fractured their fibula and not their tibia. Second question. An individual with very low levels of vitamin D presents themselves to you complaining of seemingly fragile bones. Explain how this might be connected. Well, when an individual has low vitamin D is actually necessary for the absorption of calcium. And calcium is important in maintaining strong bones. So if you have a deficiency of vitamin D, you're not able to absorb calcium in the amounts needed to maintain strong bones. And if you don't have the necessary amounts of calcium in your system, it will cause your bones to be soft and brittle and thin. If you have a deficiency of vitamin D as a child and you're not absorbing calcium adequately, it could cause rickets disease in children, and it can cause osteoporosis in adults, and especially geriatric patients, because we know that geriatric patients, our main concern with them are falls, and that is because they don't absorb nutrients, especially vitamin D, that leads to better absorption of calcium as much or effective as they should in order to be able to recuperate properly from a fall. Question number 3. During the early years of space exploration, our astronauts who had been floating in space would return to Earth showing significant bone loss dependent on how long they were in space. Discuss how this might happen and what could be done to alleviate this condition. Well, just like anything else, if you don't use it, you'll lose it. Well, with the astronauts being in space, where they're floating around, they don't have gravity to cause them to put weight on their bones. Bones need weight in order to stay strong, in order to not have muscle loss. And you need the weight bearing exercises to be able to keep the bones strong and be able to um, perform the way you need to. So that's why walking and jogging, when you're here on Earth, gravity, is the main component that keeps us, walking around using our bones. But when you're floating around in space, you don't have that. So that is one reason astronauts use restraints to keep them on a treadmill, to keep them grounded on the treadmill, so that way they are able to do a type of weight bearing exercise to keep their bones in shape, and so that way they don't have the issue as much of losing, the bone in order to be able to um, perform like they need to when they return to earth. Thank you.